Ladies and gentlemen, please welcome once again Mr. John Crowley.
Great, thanks, Debbie. I've learned a lot in about a dozen years in biotechnology, and if I can tonight, what I'd really like to do is to share my perspectives of all that I've learned from so many people. I can tell you about a year ago, almost to this week, when the movie came out about our lives. We got to travel with the stars of the movie, and we got to tell the story of our family. We got to tell a bit about our journey, and we got to talk an awful lot about rare diseases. And the one question almost everybody would ask is, what is this movie about? And, we used a lot of words to describe it. We used words like family and faith and science. But in one interview, I used the word entrepreneurship. I think that's what it's really all about. And somebody said, why? And I said, well, you got to think of everything that you'll see when you watch this movie, and knowing our lives and a lot of the ventures, including the current one that I'm involved with. It's about this industry called biotechnology. And sometimes it's a lot of fun, and sometimes it's really, really hard. And there are days where it's 2 steps forward and 1 step back, and sometimes the science just doesn't cooperate, and we get that backwards. But I could tell you, it really is about the journey of entrepreneurs together. Everybody at Amicus today, just like we were almost a decade ago at Novozyme, like everybody was when Saul founded Celgene, and like everybody has at that company and many others, if not all of us in this room today, it really is about entrepreneurship. And so when I think about entrepreneurship, and we think about, they came up with this title for the movie, Extraordinary Measures, and you got to think about all the extraordinary measures, everyone in this room, whether you work in biotechnology, whether you support it in any way, everything that we've done to go that extra mile, to work that extra hour, to take that extra trip away from our families. There are lots of other titles they came up with the movie. They had So Determined, So Defiant. I think at one point Dumb and Dumber 3 was up, but thankfully that fell off the radar screen. But along the way, those same themes kept coming back about people rising up against adversity in their personal lives, in their businesses. And when you think about it, entrepreneurship really is just that. It's a state of mind. For many of us, it's a state of being as well. And what we really do in biotechnology is we are the force of creative destruction in science. One of the things we did at Amicus in the early days was we put together a vision statement. And I had tasked about 8 or 10 people, all non-executives in the company, and we were only about a 25-person company back then. And I asked them to come up with our vision statement, and the only thing I asked is that it begin with the 2 words, we believe. And after weeks and months of work and back and forth, we came up with a vision statement. And it's the one that's still in our lobby today on every one of our walls. And one part of that vision statement says, we have a duty to obsolete our own technologies. And again, that's really what an entrepreneur is all about, is asking those tough questions, pushing those boundaries, whether it's with investors, whether it's with your own scientists, other companies you may work with. And tonight I'd just like to share with you briefly a couple of different lessons I've learned from some of the greatest entrepreneurs in biotech that I've seen or worked with. One characteristic that every one of them has, and it's, I think, the true inspiration behind the award in Saul's name, is vision. And behind that vision is risk-taking. Many of us are really familiar with biotechnology. Some guests here tonight may be new to it. But if you go all the way back and think that this is an industry that's really not that old, 34 and a half years ago, and it started like every good business did. It started with a venture capitalist. In our case, in biotech, it started with a scientist. And they got together, and the biotech venture investor was 29 years old, an associate at Kleiner Perkins in 1976. And he was really into science. And he wanted to know more about the ability to do things like split genes and insert DNA sequences into other organisms. And he went to see some of the docs doing the cutting-edge work, one of whom was right nearby for him. He was out in the Bay Area. He was at the University of California, San Francisco, and with that, two guys, one 29-year-old, one 40-year-old, one venture capitalist, one scientist, got together, and they met in the scientists' labs, and they started talking, and they got taken away by the breadth and the potential and the vision for what this could be to, again, fundamentally alleviate human suffering. And they carried their meetings, again, in a place where all good businesses come to true fruition, to the bar across the street. And literally, on a cocktail napkin, they began to sketch out what would become a company called Genentech. And you fast forward today and look at medicines like Avastin, Herceptin, Lucentis, what they've been able to do to fundamentally change people's lives. And it's never been easy. They've had good times, they've had bad, like everybody in biotech ever has. But what a great foundation company for our industry. And as Debbie indicated, we have one of the very best examples of vision and innovation here in the state with what Saul and his team were able to do in the last 2.5 decades at Celgene, to actually have the idea that you could take a molecule that people didn't even want to mention the name of, in the case of thalidomide, and think that you could push the envelope of science and develop it into a medicine, first for a niche indication like leprosy, and then finally to push it into oncology after all those years of work and research and get it approved in blood cancers, and now to see not just the great company that Celgene has become, but to see the difference that it's made in people's lives. They didn't do it, though, without risk-taking. You know, this has been a really tough couple of years in America, in the world. We've all been deleveraging, and we've all been frugal, and we've all been thinking, gee, what do we really want to do with that hard-earned money? And that's the same thing that the folks who run the mutual funds and the hedge funds think about. And boy, biotechnology by its nature is never going to be a risk-free or a low-risk investment. We've seen a lot of challenges in the amount of money coming into our companies, in the setbacks. It used to be if you had a setback in the clinic, well, that's okay. You know, gee, you can only go out and raise 20 million instead of 40 million, but you'll get through it. And it's not that way anymore. But I hope we never lose the vision, and I hope we never lose the appetite for risk-taking, because that's really what it's all about. The second trait I've seen in every great entrepreneur I've ever worked with is persistence. I had to learn it the hard way. When I went out to Oklahoma to help start that tiny little biotechnology company to try to come up with a medicine for our kids' Pompe disease, I went out with 2 personal possessions. I went out with a framed picture of Eileen and the kids, and I had a tiny little bookmark that my mom had sent me about a week earlier. And I took that bookmark, a little brass plaque, and I put it inside the frame just because I didn't have any place else to put it, and I didn't want the cleaning crews at night to take it, and I just kind of tucked it into the picture. And it was a quote from Winston Churchill, and it said very simply, never, never, never quit. And I have to tell you, not just at Novozyme, but a lot of times in more than a decade of running these biotechnology companies, there are plenty of days where I wanted to quit, to hang it up, where there were people better than me, smarter than me, richer than me, better connected, everything, where I couldn't lead a team right, where I made mistakes that cost us time, money, and God forbid, suffering and lives. But through that all, I had the picture of the family, and then I had that little plaque, the never, never, never quit. And that's the persistence that we need. If you don't have that appetite for risk in the first place and the persistence, and I'll share with you a personal story of how Saul was incredibly helpful for me a year and a half ago. We, Amicus, went public in the spring of 2007, and it was a great ride, terrific IPO, drugs moving forward in the clinic. Everything seemed to be going fine. And then we had a drug in phase 2, and it didn't work. The phase 2 failed against a really tough economic background in the fall of 2009. And again, it wasn't the type of an environment where, gee, the drug didn't work so well, let's put it back in phase 2. I couldn't afford to try to get the dose right a second time with this drug. And I knew we'd have to make some really tough decisions. And that was the night you sit down with your chief operating officer, your chief medical officer, your chief science officer. And they walk in with a binder for the big results you've been waiting for. And there's no champagne, there's no smiles, and they go through the data. And you try to figure out, okay, what is it? What do we know? What do we not know? Can we fix it? Should we fix it? And we realized that we just couldn't invest. We had to focus on our lead drug. And so we went to our board. We met as a team for a couple of days, shared the news with our board. Before I did that, I called Saul. And he took my call, as always, right away. And he said, John, what's up? I said, Saul, I said, I got the Placera and that the data on that Placera study in Gaucher. He said, how's it look? I said, not good. And so we went through the science and some questions, and he knew immediately. I said, Saul, I don't know. I think we're going to have to lay people off and restructure. And he goes, John, sometimes you have to do that, and we'll help you work through that, and we'll support you. But you know what? Every biotechnology company that's successful today has been through this. Every one. He said, it's not a question in biotech of, gee, what if we fail? He said, you're going to fail. Something is not going to work. He said, and in this study, something didn't work for whatever reason. He said, but keep your head down, keep your sense of what you're doing, and you'll get through it. And I got to tell you, you talk about wisdom in words, and for a young CEO to hear that, for somebody who's been through it, who can empathize, for me meant all the difference in the world. So we knew we had our vision, we knew we were risk takers. I think we were pretty persistent through it all. And you got to think about then, kind of what else do you do? You got to be optimistic. As an entrepreneur in biotech, the glass isn't only half full, it's really, really clean too. Yeah, I've learned from Saul, I've learned from a lot of our board members, I've learned from all my teammates at Amicus. Learned a lot from Eileen. And I've learned a lot from our kids. And all kids have this amazing way of teaching their parents, oftentimes without their ever knowing that they're teaching us along the way. And yeah, Megan and Patrick and John, in his own way, they have really special needs, but they have amazingly special gifts. And one of those gifts that they each have is the gift of optimism. Every morning when I'm getting ready for work and it's crazy in the house and the Jack Russells are running around and God knows how many nurses are coming and going and I got to get John to school on time, Megan always comes flying in the room. And here's a kid, you talk about managing adversity in life. A kid since she was about a year old who's had physical challenges that none of us in the room could ever even imagine. And the grace and strength that she's lived are an amazing example. And every morning when she comes in and I'm shaving and cleaning up and rushing around, I ask her the same question. I said, Megs, how you doing this morning? And she comes flying in her wheelchair, and she gives me the same one-word answer every day. It's become a bit of a routine for the last many years, and she's in 8th grade now. She gives me one word, awesome. She said, I'm awesome. And I got to tell you, if a stranger passed Megan in the street and you asked him to write 1,000 adjectives about the young girl on a piece of paper, I bet you anybody who doesn't know her wouldn't write the word awesome. But that's how she thinks, and that's the optimism that she brings. And I got to tell you, it's a great lesson for us big people. There are so many times in life, as a dad, whether you're struggling in your career, if you lose your job, you have to lay off a friend, whatever it may be, where you feel sorry for yourself. Life's not fair, and gee, it wasn't supposed to be this way, and gosh, I'm trying hard, but the world's against me. And I got to tell you, the lessons that we've learned from our kids, and I think about Megan and Patrick, and in his own way, John, and the adversity that they deal with in life every day. And I just think about shaving in the morning and looking in that mirror, not at me, but looking at Megan's reflection in the mirror, and that one word, awesome. And it really puts it in perspective. And part of that optimism is, again, just never feeling sorry for yourself. We, as the kids, thankfully, are, Patrick, Megan, and John are 7th, 8th, and 9th grades. The medicine that we help to develop with a lot of people's help is a first-generation therapy. It's fixed and reversed the dangerous enlargement of their hearts. You couldn't tell their hearts from another kid's today, healthy, but they're still profoundly affected by the muscle disease that set in when they were young. But they're living so much longer And we bought a lot of quality of life, almost a decade now on this medicine. And we bought a lot of time. And hopefully now this will be an exciting year in Pompeii. We've got a whole range of therapies in academic centers and companies, potentially 3 new therapies coming in the clinic this year. If you think about vision and risk-taking and persistence and optimism, that's what it can ultimately lead to. And you look at kids like Megan and Patrick and the adults living with Pompeii and all the thousands of people in the world. Who are they relying on for help to get them new medicines? It's the docs that they see all the time, but it's people they don't even know. It's people like us working in biotechnology companies. When I first started in biotech that very first day, I didn't go out to the company in Oklahoma. I flew up to the Bio Show, and this was before Jim Greenwood was running it, when Carl Feldbaum had Bio in 2000, and it was a show of maybe 5,000 or 10,000 people attended up in Boston. Some of you may have been there. And I just wanted to immerse myself in the industry. I wanted to learn, and I sensed something different in this industry. For as great as the pharmaceutical industry is and can be, I just sensed something different. And maybe it's that sense of entrepreneurship, that sense of optimism, just something different. I couldn't put my finger on it that first day, but I went to the keynote address that night, and it was given by a gentleman who was a quadriplegic in a wheelchair. And he came out, and you could just sense for the lack of physical strength, you could just tell the strength of character that this guy had. And he came out, and the first word he said was biotechnology. He said, that's a great big word, but for people like me, just means hope. And he said, it's hope that one day one of you in the audience, or maybe small groups of you, will go back and work on a cure or a treatment for paralysis. He said, but I realize it may not be now, it may not be in time for me. And he was right, and a couple of years later, that gentleman, Christopher Reeve, died from complications from his paralysis. But you think about the legacy that he left, and for those years, 9 years almost, that he suffered as a quadriplegic, he didn't just suffer, he lived. And he had abundant optimism and confidence in the foundation that he and his wife Dana left. Someday, there will be a cure for spinal cord injury. And I guarantee you people can look back one day and thank somebody like Christopher Reeve. Another great trait of every successful entrepreneur, and Saul embodies it, and John Johnson last year, and Lisa before, is humility. You know, we have some great times in biotech. Some days it's really great to be a biotech CEO, and the study comes back positive when you get that data. You know, Amicus, when it went public in May of 2007, you know, we were feted by every investment bank, and you go around you guys remember when there were IPOs, right? So this is about 3.5 years ago. And you feel like kind of a big deal, and you go around, and they give you the limos, and you get the people to, you know, walking around with you, and the schedules every morning. They give you a Gulfstream airplane, and you're zooming around the country. We come back to New York after our 2-week roadshow. We had a luncheon in New York, 70 investors who couldn't get individual appointments with Matt and I and David Lockhart, our CFO at Amicus. They came to the lunch, and we could have raised 7 times more than we did. And we raised $75 million. We had a board meeting, and the board, everybody's really happy. You go to bed that night, you wake up the next morning, it's in the newspaper, and you know, all of a sudden, Wall Street put this $300 million valuation on our tiny little company, plus $75 million in the bank. And we go to Morgan Stanley, and we open up the stock trading, and then we get travel around the city. We have a nice celebratory lunch. We were maybe 75 people at the time. And I bussed the whole company up from Cranberry, New Jersey into New York to the NASDAQ because we were going to close the stock market that day. And we did, and it was great, and we got all the executives from Amicus on TV and did an interview, and then you go out and they put your signature and your picture and your company logo in Times Square. That's about as good as it gets as an entrepreneur, and you feel really good about yourself. And we had a party, but I was tired. Everybody went out and had fun, and I'd been gone for the better part of 2 weeks. Eileen was in with me at dinner, and I said, let's go home and see the kids. And we got back a little bit late, and I walked in to Megan's room, and it was just Megan. Her nurse had stepped out. And she's kind of a light sleeper, and she woke up, I gave her a kiss, and she said, Daddy, how'd you do? How was your big business trip? And I said, well, Megan, I said, we did pretty well. She said, I know, I saw you on TV. I said, well, Megan, I said, I had my suit on, the power tie. I said, how'd the old man look? And she said, well, actually, Daddy, you looked really, really, I was thinking powerful, and she said, you looked really, really kind of short. So I just kind of stood there. She was 10 at the time. I said, thanks, Megs. And of course, Megan is the master at how to damn with faint praise. So she said, but Dad, that yellow tie on TV, awesome. Thanks, Megs, awesome. And she asked me, she said, Dad, are you going to be here in the morning? I said, yeah, Megs, I'll be here. She said, will you take me to school? I said, sure, I'll take you to school. She said, okay. She closed her eyes. She said, good night, I love you. I said, I love you, Megs. And I think in that moment, I realized the true humility and success. We are humbled all the time in biotech as we struggle and oftentimes fail in drug development. But I think the challenge is in those really good times to keep that humility, keep that perspective. And it wasn't the humility of Megan teasing me. She teases me all the time. It was in realizing that, you know what, she really, truly didn't care about a big IPO or Gulfstream airplanes. What she really cared about was that her dad was gone for 2 weeks, and she really missed him, and she really wanted him to take her to school the next day. And maybe that's the right perspective I know that so many of us, all of us, have in this room. And there are times where it's easy to forget about it a little bit or lose that perspective. But I could tell you, every great leader I've ever met or worked with, they have that perspective, they have that balance. And they realize that, in the words of Anna Quinlan, who wrote A Short Guide to a Happy Life, a wonderful little book if you have a chance to read it, she wrote that life is a terminal illness and we're all going to die from it. The measure of your life is how you live the days in between and how you spend your time. So if I could leave you with this last final thought and something else that I've seen every great entrepreneur in biotech and in any industry I know ever do, and that's to find that balance in life. We all have to work hard. Hard work is the price of success. But you've got to find out, where's the breaking point in your life? How do you find that balance? How do you make sure that you have the time for your spouse, your family, your friends? There is that balance in all the great leaders I know. Saul, John, Lisa, before me embody it. They all realize that perspective, that balance, and they all know that the real secret to vision, innovation, and leadership is to take time. I will close with these words that Geeta Anand, who wrote the book The Cure, about our family's journey that inspired the movie, that Geeta wrote this in the last paragraph to her epilogue. And I think she captured so beautifully well the perspective of time. Geeta wrote that as human beings, we are defined at our cores by how we respond to hardship. Writing about the Crowleys has taught me that there is not one right way, but that each person must find her own path, drawing on her own unique strength, passion, and resources. Who can say whether John or Eileen's role is more important? Fueled by love, each of their journeys is tough, vital, and courageous. Knowing that each day may really be their children's last, they live with abandon, throwing themselves into every birthday party, trips to Broadway, weekends at Ocean City. Knowing so intimately the tenuousness of life, they instinctively understand what most of us sometimes forget, that all they really have and all they really are pursuing is time. Time with the people they love. And so they grab on to each precious moment, cherish it, celebrate it, laugh at it, cry at it, and hope for another, even as they continue onto the journey into the unknown and the unknowable that we all call life. Thank you. This is a true, true honor to get this award in Saul's name. And thank you for all you do for so many people. Thank you.